sessions from last week have already been made available. So I believe that supervisors should have sent those out at some point. And these sessions from this week will also be posted on the same site probably by early next week. So thank you again for joining us. Does anybody have any questions, comments, feelings right off the top before we jump in? All right. So I am going to just do a brief overview of what we're going to review today, and then we will get started. So first, we're going to look at how to update some Medicare information. Then we're going to look at what if we need to add somebody into benefits 24/7 who's not already in there, and how do we accomplish that? Then we're going to look at submitting and processing a special open enrollment request, as well as completing dependent verification. Then we will look at how to terminate coverage. Then we'll be looking at terminating and re-enrolling if we need to transfer a payment method. Then we were going to look at the subscriber history, although I saw in my session for outreach and training prior to lunch that our history was not working again. So we'll take a look, and if it's still not functioning, we won't be able to review that. We'll take a look at how to update a dependent certification, and also how subscribers can submit an address change and how we verify those. So that is what we're planning on reviewing today. With that, I will go ahead and jump in. Again, please feel free to ask questions at any point in time. Just go ahead and unmute yourself and interrupt me. You can also use the chat if you would like, but please ask questions as often as you'd like. I will say the group earlier this week, we did finish just a little over an hour. So I fully intend to be able to give you guys time back in this meeting, unless we have a lot of questions, which I will happily stay as long as needed. Okay, so I'm going to dive back in here. So I am going to go to my self-pay dashboard. And I know typically when we get Medicare information from somebody who's maybe already enrolled, likely that's going to accompany a special open enrollment. But let's just say in the case of somebody sending in a Medicare card and we want to add that information to their account, even if they're not enrolled in retiree coverage, whatever the work scenario may be, I do want to show how we can go and add that Medicare information to somebody's account. So if we go to our manage subscribers on the self-pay dashboard, and then we search for the individual, either by name or social, whatever you have available to you. We're going to select our subscriber. In this case, I have a termed school employee, and then I'm going to manage that subscriber. And then from here, in order to update their Medicare information, I'm going to go to their eligibility page. So I'm going to select the eligibility tab here. And now as I scroll down, we have our self-pay eligibility information, right? We've already added them to coverage, so we can view that eligibility information, much like the 41 screen. If we need to add Medicare information, we can expand this Medicare enrollment information section. So here's where we could come in and add that Medicare enrollment. So if we say Part A and change that to enrolled, and let's just say it was from March of, not last year, 2023. And then as applicable, we can also update Medicare Part B. whatever applicable start date for that. And then our Medicare number. Making it up as I go. And once we enter that Medicare information and the start dates and the Medicare number, if there's anything else we need to update on the account, we can do so at that time. Otherwise, we would just go ahead and hit submit. Pretty straightforward there, how we add Medicare information. The same would be true for, I'm trying to remember if I have somebody in here that has dependents. Let me take a look really quick. I know somebody that will in just a moment. So the same would be true for a dependent. So I can show you guys that process after we add somebody to as a dependent through an SOE. So any questions about adding Medicare information, where we would go to do that? All right. I'm going to go back to my self-pay. I see a hand. Yes, Alexi. Just
I
go
put
ahead
it
and
in the
unmute
chat.
yourself. Okay.
Um, Mine, I just wanted to know if it will let you do like a 4/1 or a 5/1 effective date for the Medicare.
It will, yes. I know that we've had that, we fixed that ability, and I don't know that that's been fixed in our training environment yet to allow the future date, but it will be. And I did ask for an update into our training environment. So hopefully by the end of Monday, we should have an updated version and training that would allow you to do that.
Thank you.
Welcome. All right, so I want to walk through now the scenario of adding somebody into benefits 24/7. Say we got a paper enrollment form and we need to add them completely fresh into benefits 24/7. So first and foremost, when you get that document assigned to you in AX, you'd want to come into the Manage Subscriber section. And first and foremost, you'd want to search for that person. So let's just say you have your social. I'm going to do a last four here. That was a bad example. You have your last four of a social security number or your full social security number, and you enter it and you search for them and you have no results, like just what happened for me. That's your first indicator they're not in the system already. This could maybe be a widowed spouse who has submitted documentation to enroll in coverage, something like that. So what you would do after you search and see that they're not already in this system, we would go ahead and select this Add Self-Pay Subscriber button here, just to the right of the search bar. So I'm going to go ahead and select Add Self-Pay Subscriber. And then we're going to go ahead and enter their social security number based on the forms that we've received. And the applicable agency effective date for what we received from them, and select next. So now this information should look very familiar, much like when you're adding somebody who's already been in the system and you're adding that self-pay origin record. It's the same information, except in this case, we don't already have their demographics. So now we need to add that. So we'll just go ahead and make up a name and give them a date of birth and sex assigned at birth, gender identity. If we have phone numbers available for them, we can go ahead and enter those. And then we would start entering in that eligibility information. So we'll consider this a retiree in this case. Select our applicable information. These are things that you guys are a little bit familiar with as we've gone through the process. So I'm not going to spend a whole lot of time. I'll go through this pretty quick. and go ahead and put our originating SSN and um, put in our required fields. Now, this is where self-admittedly, I am not the most familiar with all of the correct information to select for the agency, original sub-agency to fulfill the scenario that I am giving you guys. So my apologies about that. Um, that is information that you all are much more familiar with and comfortable with entering. So I may have select bad information to create this person, but I did just want to walk through the process of getting somebody added into the system who's never been in before. So forgive me if I'm showing you bad data as far as the values I'm selecting. Okay, so I input my address information and now I'm just going to go ahead and submit. So once I have completed that, I can go ahead and search for my individual again, because the next thing we want to do after we have added them into benefits 24/7 is we want to select and manage the subscriber. And we want to go onto their dashboard and we want to go to the retiree continuation coverage section. And from here, we want to actually create a request. That's what's going to give us the work item in the queue to then go ahead and process those enrollments that we got on the paper form. So we come in, we select the request type and whatever the appropriate request is, and then we select create request. Here is where we are actually going to say, yes, I want to opt out of completing the form, because this is, if we said no and walked through the enrollment form, we'd be recreating the paper form that we've already received. And there's no need to do that. We already have the paper or the imaged version of the paper form. So we can just say, you know what, we're going to opt out of this. We select yes, and that's all we have to do here. So now that that request, that retiree request, is in our queue and waiting to be worked. So we submit that request. We say we're going to opt out of the form, and we're done on this page now. So once we have submitted that request and got it into our work queue, we're going to head back to our self-pay dashboard. And now we're going to go into our request queue here. And if it was already assigned to me, I would see it in my list. Otherwise, I'm just going to unselect items assigned to me. And then I'm going to look for the request that I am working on. In this case, it was subscriber adding self-pay. And I'm going to expand that record. I guess first and foremost, we should probably do the right thing, which is make sure it's assigned to us so nobody else jumps in and starts working that record. So first and foremost, assigning it to ourselves, and then we would come in, expand the request here, and then we would start moving into our processing. So we've gotten the paper documents and we know that they've sent in their payment information as well in this case. So we're going to go ahead and approve the request and just submit our changes. And then now we can go straight into processing that enrollment. So we select process enrollment changes. We put in the correct coverage effective date that was provided on our document, and we hit next. Now we're just going to walk through the wizard and select plans based on what the individual put on their document. So select a medical plan here. We'll select our dental plan. That's what they wanted. Confirm and manage dependents. If they had included and requested to add dependents, we could go ahead and say yes and go through that process of entering the dependent demographics and adding them to coverage. I'm going to go ahead and skip that for now because we'll walk through that process again in a moment. Now it's going to ask me to proceed to attestations, and we select the correct tobacco surcharge attestation per the document. So we'll say, you know what, we'll say yes for today. Acknowledge the legal notice, and then select to confirm and review. So here now we see our member, their coverage effective for medical and dental. We see the plans that they selected, and we see that they are being charged the tobacco surcharge. Continue to review, and then confirm on the legal notice. And now that enrollment has been processed. So same process of going through the request once it's been in the queue, but wanted to acknowledge that little extra step of if we've gotten the paper form and they're not in the system, we add the subscriber first and foremost, then we create the request, we opt out of the form, and then we go directly into the request and we can process the enrollments. The same does go for if we already found the individual in benefits 24/7, we've gotten a paper document, we know that scenario is much more likely to happen. We already have their information. We've gotten a paper document from them to process. We go and search for that subscriber. We do the same thing. We go and create that request, whether it's a retiree, a COBRA, or an unpaid leave. We create that request and we opt out of the form. And that's how we can then get the request into our queue and start processing. Any questions about the order of operations or how to create a request when we get a paper document? Okay. Well, I am going to go back to my self-pay dashboard here. Now I am going to walk through how to submit a special open enrollment request. So again, I'm showing you guys this from the perspective of a subscriber or a member doing this, understanding that likely it's not part of your regular workload. However, I do want to make sure that we acknowledge that process because it is likely that you'll have questions that come in via phone call on what steps they need to take or things of that nature. So I want to make sure that I'm showing you guys the process from the subscriber perspective and then going through how we then handle those requests and do our regular workload. So I'm going to search for my subscriber so we can submit that special open enrollment request. So from here on the subscriber dashboard, they have a special open enrollment and account changes tile. So this is where they would go to submit that special open enrollment request. So I'm going to go ahead and select this. And they're actually in the drop down here, which you can't see. There's actually two options. First and foremost, I want to show you that you can do our members, sorry, can submit a change of address. So one of the options in the dropdown is change of address, and we also have a special open enrollment request, which we'll talk about in a moment. So a change of address. They select this and do add new event. And here, what we show them is this is the address we currently have on file for you for your residential. If they had a separate mailing address, we would also show that this person has their mailing same as residential, but maybe we needed to add a mailing. So we could come in here, unselect the residential address, and then let's just say we're adding a PO box in this case. And then If they had any dependents on the account, they would also be listed below, and you could add a separate mailing address for those dependents. So they could make whatever changes they need to and simply submit. So now this goes into our queue. So I'm going to go back to the queue and show you what it's like when we get one of those change of address, and then we'll go through the special open enrollment. So I'm going to go back to my self-pay dashboard, go into my request queue. And then here, now I see that change of address request. So make sure I assign it to me. And then I'm going to expand that event request. And I can look at my form that was submitted by the subscriber. And here I see the new information that they submitted. Just give it a glance over. If there was any dependent changes, we would see that here. This document does just show what they're requesting to change their address to. So make sure that looks good, and then you can go ahead and just approve it and submit changes, and that's all you have to do. So with an address change request that comes in, you don't have to go into any kind of processing and go rekey that address. The subscriber's already done all the work for you. You review the request and then you approve it and you're good to go. Now it's applied. So if we go back to that subscriber and go back to their dashboard, then I can show you on the profile, we can go to their mailing address that we just added, and now you can see that populated there. So once we've verified that event or that request, it's automatically applied in the system. So that wanted to address the change of address. Now let's go back to special open enrollment here. Let me keep track on my document. Okay, so now that this, you can see that the request has actually been approved, and the subscriber can look at their PDF of what they submitted if they need to. They can no longer delete it at this point in time because it has been approved. And they also now can submit an additional event. So we're going to go ahead and walk through a special open enrollment request. Add a new event. I'm not going to opt out because I want to show you guys the form process here. So here is where we actually see what we see the list of events. So the subscriber themselves would select what event is applicable for them. In this case, I am going to do a loss of other coverage, and I'm going to add a couple of dependents. So I'm going to go ahead and select continue. Select our applicable payment method and proceed to the enrollment form. It's going to look very similar now to what we've seen for the retiree and continuation coverage request forms. So no updates to our Medicare here, not subject to the tobacco surcharge. Now I'm going to go into the dependent form. So here I have the ability to add dependents, and I just told you that we were going to add a couple dependents as part of this SOE request. So first and foremost, I'm going to add my spouse. And then all right, got married. And then we want to select the type of coverage. So cover or remove from coverage for medical and dental. In this case, we're going to add to both coverages. The spouse also is not a tobacco user. And then, of course, they need to answer the spousal surcharge question. So in this case, no, I'm not subject due to question 2 because my spouse actually lost their own coverage. So I'm going to go ahead and hit Save Dependent. And now, because there is another thing I'm going to show you a little bit later on, I am going to add one more dependent. So I select the Add Dependent button, which I can do as many times as I need to until all dependents have been added. I'm going to add a disabled child because they were on my spouse's coverage that was lost. So oh, okay. Enter this information. And then select what coverage we would like them added to, and tobacco surcharge, and save dependent. Okay, so now I've added my dependents and I'm going to continue. Here is where I would select the applicable medical plan. We're going to stick with our UMP select here. None of us are on Medicare, and we're going to continue. Going to select uniform dental plan. They would upload any applicable documents. So in this case, I am going to go ahead and upload my tax return. I'm going to select that it is a tax return in my drop-down menu. I'm also going to upload my, and we're going to make pretend, I'm going to upload my document that shows where my spouse's coverage was terminated. So I'm going to add the termination letter. So my dependent verification, because I'm adding dependents, and my document that validates my special open enrollment event. As many documents as I need to upload, and then I just want to select upload and submit changes. They've been successfully uploaded. Now I can go ahead and continue. And that is really about it for submitting a special open enrollment request. So they have the ability to download it at this point in time before they submit, or they can just go ahead and submit. So now here we can see that SOE request pending, waiting for review. They have the ability to jump in and edit it. They can delete at this time, and they have the ability to see that request PDF. So we are going to take a look now at processing that SOE request, unless anybody has some questions. All right, let's head back to our self-pay dashboard. And you can see, I don't know if you guys are paying attention to the numbers. These sections in the system, if new requests come in, you'll see the numbers on these change. So I don't think I pointed that out before. So first we're going to go into our request queue here. Go ahead and unselect. And then we are going to look at the special open enrollment request for our subscriber. Go ahead and assign it to me. Now I'm going to expand this. Here's where we would, of course, do our due diligence of opening and reviewing the request. So I select that request. I fully acknowledge that this, we have a little bit of an issue with this, this change request document. So we will make sure that this is resolved. But this is where we would see what the event was that they submitted, when they submitted it, and then we really get into the various information of what they have submitted. Plan selection here, and then it would go into our dependents, spouse being added to medical and dental. We see the attestation information, and then same for the other dependent that was added, what coverages they want to be added to, and applicable attestations. So at this point, we say this SOE looks valid based on the form. Of course, we check our other documents. Tax return looks great, proves the dependents, and termination letter. I told you guys we're making pretend. This is a termination letter that says these people lost coverage and when that was valid. So we can go ahead and now we can go ahead and say, you know what, this looks good. We're going to go ahead and approve this. Select the approve option. You shouldn't need to change anything with the status, the date, or the processing status, but if you needed to, you do have that ability. And then you would go ahead and submit changes. So just like all of our other requests, as soon as you approve the request, now we can go in and process the enrollment changes. We would input that coverage effective date. And we submitted on 3/24, so our coverage would be effective 4/1. And we're going to select next. And then here we select the plan options, of course, based on the SOE request. So we go ahead and select UMP. Our dental is automatically selected. And we see that enrollment here. So now we're going to go ahead and confirm and manage dependent. So this is a little bit different than what we've seen with our regular processing of requests. So a new request that's come in, this one looks a little bit different here. So what we see is the spouse and dependent who have already been added per that form. We can go ahead and select import this dependent. So I'm going to go ahead and select. And what this does is it populates all that information that the subscriber input on their special open enrollment form. So we can just go ahead and confirm this based on the information we received. Looks like a couple fields here we need to make sure that we select. And then we did not get a different address, so we can go ahead and select that it's the same. If we received Medicare information, we could go ahead and enter that here, but we didn't have any in this case. So we're going to go ahead and add coverage. You can see the medical and dental is already selected per the form that was submitted. And I will refer back just so we can confirm that here. Medical and dental was selected for the spouse. So we'll go ahead and hit next. Then we want to double check our tobacco attestation. It was a no, so we can go ahead and select no. And then we move into the spousal attestation question. So they told us that the response was no on question 2. So we're going to go ahead and select no for question 2 here and hit next. We're get a notification that you're not going to have to pay for the surcharge, and we proceed to the dependent review. So we do a glance over of this information. This is the spouse, medical and dental enrolled. There's no Medicare, no surcharges apply. Now we can go ahead and save and finish. So once we've done that, you can see that they are no longer on our list to import. That means we've already completed our task on adding that dependent per the SOE request. So we'll go ahead and do the same thing for the other dependent who was added. So I'll move through this one a little bit quicker here, since we've seen this a number of times. Go to add coverage, automatically selected here. So we say next. Our dependent said no for tobacco, so we select no, and we proceed to the review. Medical and dental enrolled, no Medicare, no surcharges. So we're going to go ahead and save and finish. So we would do that as long as those dependents are valid and should be enrolled until all of the dependents have been added. If there was somebody else that needed to be added, of course, you have the ability to do that here. Otherwise, we're going to select no, and we're going to say next. Now we get a review of those dependents that were added, what coverages they were enrolled in. And then, of course, if we needed to make any edits, we could select the edit dependent buttons here, and it would take us back into those dependent records, and we could make changes at that time. We're going to go ahead and select to move forward. Since we're processing this, we don't necessarily need to upload anything, so we can go ahead and proceed to attestations here. Acknowledge this messaging here. The subscriber's tobacco surcharge is auto-populated. So we can select next and then acknowledge this legal notice and confirm and review. So now we see that new medical effective date, and we see those new dependents have been added here. And then we go ahead and select next and next again and confirm. So now that special open enrollment has been verified. So if there are any documents attached to the SOE that apply to the dependents, so in this case, the tax return, just want to make sure that you double check the dependents are on, whatever the documents are, that they are valid for the dependents. And once you have given that a glance over, you're going to go back to your self-pay dashboard here. Now we see our dependent verification. We actually have some new verifications in here. So I'm going to go to the dependent verification tab. So once we have actually gone through the process of verifying that SOE and completing the enrollments, we then want to come into the dependent verification section if dependents were added as part of that SOE event. And we want to complete the dependent verification portion. So I'm going to expand this spouse here. And we already looked at that tax return. The spouse was on there. We're good to go. Everything matched up based on the information we received. So we can go ahead and verify this. And we did get a tax return to verify that. So we're going to go ahead and submit changes. Now that spouse has been verified. So we're good there. The other thing I wanted to take a look at while we're here is what about disabled dependents? And this also applies to if there are extended dependents. So you can see here that the status is a little bit different. It says pending certifications, and we know that disabled and extended dependents require additional documentation to be certified. So when you expand the record for a disabled or extended dependent, you have a little bit of additional information here. You see this certification section. So first and foremost, recognizing that there is a whole process that goes on that by our disabled dependents team in order to actually complete the certification. I want to walk through this process just so you guys understand where we can look for certification information, or if we're doing an extended dependent, which is more common to what we might be doing in our work, where we could go and add that certification information when we are verifying folks. So we come in here, first and foremost, we know that they are verified. We looked at that tax return. We saw that they, are in fact a dependent. So we're going to go ahead and complete the verification and submit our changes. Unlike the spouse that we already verified, they didn't fall off our pending list. They're still here. And that's because they are pending certification, right? We know disabled and extended dependents cannot be enrolled. Even if they're verified, they cannot be enrolled until they have a valid certification period. So I'm going to come back in and expand this request. Now I'm going to expand this certification section. So once we see this, if there was already a certification in here, maybe it expired. In the case of an extended dependent, it expired 12/31 at the end of the year, and you're coming in to add a new certification for the following year. you would already see that previous record, and then you could just come in and select to add a new one. So for extended dependents, there is only one certification type option, and that's temporary. In the case of disabled dependents, there are temporary and permanent, because we know disabled can be certified in a permanent basis. But we're going to go ahead and select temporary for today. And we're going to go ahead and say that the start date was 4/1. That's when we enrolled them in coverage. And they are going to be certified through the end of this year. We enter that start and end date and we hit save. One last thing that we need to do in order to complete the certification: expand again and expand the certification section. We now see that certification has been entered with a start and end date. We want to go to this status tab, and this is in the drop down is approved, not approved, maybe there's pending additional information. So once we have entered that certification, we want to come in and change this to approved, and then the review date, we can put in today's date. We do have a request in the future to make this status automatically change to approved once the certification has been entered. That functionality has not yet been built and will likely be done somewhere down the road in 2023. But just wanted to let you guys know. So once we go ahead and change that status and enter in the review date, we can now go ahead and submit changes. And now that individual has fallen off of our list. Also, much like the regular request queue that you work out of, with our dependent queue here, if you, we have the checkbox for show only pending requests. And so you can simply unselect that, and then you can see any dependents that have already been verified or denied, as well as anybody who's pending. So you could come in here and, if perfect example is if you needed to search for extended dependent and add a new certification, unselect the pending request. You'll likely need to do a filter search because there'll probably be a lot in here. And then you can come in, expand that subscriber dependent record, and add a new certification. Any questions? That was a lot that we just went through all at once, submitting and processing an SOE and doing dependent verification. Do we have any questions about that process? Okay. Well, next on my list, we are going to look at how we would terminate somebody. So so we get a phone call, a written letter, however the request may come in. It could also be an actual request that was submitted, but we need to go and terminate somebody's coverage. So in this case, our member submitted a paper form, and we're going to process the termination. I'm going to search for that subscriber and manage. And then from their dashboard here, I'm going to go to their eligibility tab. And we are going to expand the self-pay eligibility record. So here you'll see that there is a section for terminate and transfer subscriber. This is where we're actually going to come in and terminate their coverage. So in the drop down, there are a few different options: change of eligibility, death, defer due to Medicare, defer retiree coverage, non-payment, self-pay end date. So we are going to go ahead and say that they're terminating due to change of eligibility. They got a new job, let's say. So I can enter in my termination effective date. So they are actually going to terminate their coverage and they want it to end at the end of April. So we're going to go ahead and terminate, enter in the applicable date, and then go ahead and submit changes. So now we see their benefits are going to end April 30th. Simple as that for terminations. Any questions there? Okay. So, the same would be true if somebody, so understanding that there is current functionality within Pay One to be able to transfer. So, say we had a retiree who was on pension deduction, and then they wanted to switch over to being billed and paying privately every month. So currently in Pay One, from my understanding, we have the ability to do a transfer and change that eligibility information. We will have that down the road in Benefits 24/7 for you to have that ability to just complete the transfer. However, for right now, the manner in which we would need to complete that is by actually terminating the subscriber, so the process that we just completed, and then re-adding them as a new self-pay subscriber the first of the following month with the correct payment method. So, same processes that we've been following, but I'll go ahead and walk you through what that looks like. So I'm going to select my subscriber here and manage, and I'm going to go to my eligibility, and I'm going to expand their self-pay eligibility record. Let me copy my social security number really quick so I don't lose it. And then I'm going to go ahead and transfer, or I'm sorry, misspoke. I'm going to go ahead and complete my termination. So I'm going to do the end of this month and I'm going to submit. So now you can see that those benefits end 3/31. And this one was an automatic bank account withdrawal. So we're going to come in and back up here. We're just going to select the Add Self-Pay Subscriber button again. And we're going to enter that social security number. And then we're going to go ahead and put in the agency effective date, which would be the first of the following month. Select next. We see that we can re-enroll this person. So I'm going to go ahead and claim their record. And now I'm going to come in and add in all of my applicable information here. And I am going to change them to just bill me to this information. And then we can go ahead and submit. So same process that we've already been doing as far as adding, terminating, but I just wanted to make that explanation because I know that current process has been to transfer and we are working through that. So as soon as we have that functionality built, we will let everybody know. So any questions about how to walk through that?
I have a question.
Okay.
If we terminate them and then we add them back in because of doing the transfer process, are are they gonna like is it gonna notify is Benefits 24/7 gonna notify the plan and the plan sends them out like new cards or anything like that, or does all of that information with the transfer just stay in house?
It actually would notify the carriers of the termination and the re-enroll. So they would likely get new cards. That is a fantastic question.
So
Yep. Yes, they
um
would get new cards from the carriers.
wouldn't that cause confusion on from the subscribers as well? Like if they're going in and doing this, just is there a pop-up or something that says you may receive new cards because of because of the process that we currently have to do?
I don't believe we have any messaging that pops up for subscribers in that case. It's definitely something that we can take down, and like I said, we are working towards updating so that we can do that transfer functionality. So great point, Stephanie. I really appreciate that.
You're welcome.
Any other questions? I'm taking that note, so give me just a second. Okay. So I wanted to show you guys the history, but we were having some problems earlier when I was trying to look at this, and I know we had problems last week. So let me see if if anything is working. Gosh darn it, we are still having this issue. So I have already asked for an update in our training environment. So I'm hoping that this issue will be resolved when we have that early next week. So I will make sure that notification gets sent out that we had an update in the system. So I warned you guys at the start that this was going to be a much shorter session today. We have gotten through all of the items that I had on my agenda. So I'm happy to take any additional questions. If folks would like to walk through anything else, I'm happy to do that. Otherwise, you're also welcome to have time back in your day. I know we all are busy and have a lot to do. So I will stick around until everybody's gone. So first and foremost, I want to say thank you all for joining. Hopefully this was insightful. Hopefully you guys are feeling excited about benefits 24/7. And yeah, please, if you have any questions, let me know. Thank you all for coming.
I had a question, Amanda. So do I have it right that a member can't just like voluntarily term one of their dependents? They can only do a SOE event? Because like
Yes.
retirees can term dependents at any time just because they want to. It's different than employees who have to have a special event to remove someone.
I think, yeah, I don't know. Jeff, are you back?
Yes, ma'am.
Retirees do not have the ability to just remove a dependent. They'd have to submit an SOE request, correct?
Technically, all self-pay users, self-pay subscribers, none of them can make any changes to enrollments, whether it be adding enrollments or removing enrollments for themselves or their dependents. It'll all come through requests that you guys will have to verify that the changes that they request are valid, and then you will actually make those changes.
But the members are going to have to go through special open enrollment event verification, like a SOE event in order to do that.
Well, we kind of touched on this the other day. So yes, right now they'll have a request type that they can use to indicate that they want to remove coverage, even if it's voluntary. I mean, at this point, I think you said it was okay if they just sent in a letter that says, I want to remove my dependent. And you could take action based on that. But we don't have a specific event that just lets them go in and submit something that says, hey, remove this coverage, because it's all based on that form, how we built it before, that lets them say, hey, I want to continue coverage, I want to end coverage, and all the things were kind of on the same form, right? So they will have to go through a form process and submit that to you. Whether or not we can streamline that and make it really nice and pretty and things for them specific to that later, we absolutely can. But yes, no changes can be made by a subscriber on their own. Everything will come through a type of request that you will have to look at and then verify that that's okay.
Okay, and if we did get like a paper term request, we would just have to go through the form in order to process it and enter it.
You could opt out of the form. You just have to create the request itself to make the change,
Right.
and then process through the wizard, but you wouldn't need to actually complete the form though.
Okay, thank you.
Mm-hmm.
Thank you. Any other questions? All right, I will stick around, but thank you all. Have a wonderful Friday afternoon and enjoy your weekend. Thank you, everybody.
Thanks,
Thank
Amanda.
you. Thank you.